I am Lori Esposito Murray, President of the Committee for Economic Development of the Conference Board, and welcome to CED's Leadership in Challenging Times series, where we feature the outstanding business leaders who are the recipients of CED's Distinguished Leadership Awards for corporate citizenship and business stewardship. This year, CED is paying special tribute to business leaders who have helped our nation navigate the many challenges before us, including the pandemic, an economic recovery that provides equal opportunity for all Americans, and building a more civil and just society. Today, I have the privilege of speaking with our 2021 honoree, Noubar Afeyan, founder and CEO of Flagship Pioneering and co-founder and chairman of Moderna, the now very well-known biotechnology company, which within less than a year of the WHO declaring COVID-19 a pandemic, received emergency use authorization for its highly efficacious COVID-19 vaccine and changed the trajectory of the virus. Noubar, welcome.
Great to be here. Thank you, Lori.
So Noubar, I'd like to start by stepping back and asking about the role of business leadership in society. We're in the midst of a debate about that role, and especially the role of the CEO on civil society issues. At Flagship, purpose, the improving of the human condition through science, and the importance of business in solving societal problems are its pillars. Can you share in more depth the principles that have guided you in your business ventures? You've done over 100 that you've fostered and have developed.
Over the last 20 years that Flagship has operated, we have been attempting to institutionalize what has previously been considered a individual or sporadic activity, if I can call it that, namely making breakthrough innovations or entrepreneurship itself. In the prior 15 or so years that I was involved in startups in biotechnology, I had noticed with great envy, I must say, the degree to which institutional investors had such a huge advantage, having gone through many learning cycles and thinking of what they're doing as a profession. Whereas, us entrepreneurs and innovators, every single one of these was a bespoke kind of artisanal activity. And I got interested in seeing whether, together with a bunch of colleagues, we could create a company, an institutional framework to do this activity. Now, we aimed our activities towards human health and sustainability. And those two things are areas where impact is very clear and palpable when products reach the market. And so we weren't working on how to make the impact more real, but we did realize that the field had basically gone to a point where it took a very long time to develop new products, a large amount of money, and the probability of success was very low. And our answer to that was basically availing ourselves to new innovations that would require leaps, not incremental thinking, not exploring of adjacencies. And it is that kind of bold step. And how do you leap? And how do you get to work on things that aren't yet thought to be reasonable, proximal, safe? How do you do that? And we had to come up with ways to deal with that culturally, the reward system, what we value. And so we've nurtured kind of a whole process and an ecosystem that allows us to do this. So we go from ideas of what could be desirable, if only possible, to the ability to leap, land, not necessarily in perfect form, and then iterate until we figure out how to come up with a reasonable solution. All of these things are enabling to the impact that we desire. And when all the pieces come together, we do in fact see significant output from that, and we're learning every passing day. So some days it feels like we know a lot, other days it feels like we're just beginning to learn.
Well, that's really interesting, and I'm going to ask you a little bit more about that, but I want to turn to the pandemic. And you experienced as a young boy the breakdown of civil society, civil war. When the pandemic actually broke, when WHO announced that this really was a pandemic with global implications, what were your initial expectations of the impact, both at home and abroad?
You're right. And in fact, I haven't talked much about this, but I did feel the kind of gasping feeling that you have when you face a Civil War. I was 13 years old, and I remember very clearly our lives going from kind of an idyllic existence in a country called Lebanon, which prior to that was, kind of filled with a life and means that really allowed people to have a wonderful existence, to devolving very rapidly into chaos. And the way, you go from, I wonder if school's going to shut down, to I wonder if school's going to open. I wonder if the bombs are going to hit close by, or they're going to be a spectator sport at the horizon. And all of these realities start kind of taking over, you're redefining your reality. And that feeling of like a free fall, I must say, is exactly how I felt, not in January of last year when we first started working on it, because I think we had kind of told ourselves that this would likely become an epidemic, but none of us were thinking of it being a pandemic quite back in early mid-January, all the way to, say, February, March, when people were beginning to think about kind of cases increasing. And it became very clear to me that as soon as we started thinking about kind of ceasing operations, it would be a very long time before such a normal state would resume, which is what you feel in a civil war. In a civil war, you're fighting other humans. In this war, we're fighting a virus that has, frankly, even more kind of global reach and kind of ability to hide itself than people with weapons. And so, but to me, it feels much the same. It's incredibly chaotic.
And so how did that play into how you fostered a culture of not only innovation, but of rapid pace, the need to move quickly, the need to work together? How did this all play into what we started this conversation with in terms of leading to the fastest development of vaccine at a very small company? I mean, Moderna was started in 2010. It was very small when all this happened, was breaking about a year and a half ago.
I would say that first, we had a bunch of advantages unbeknownst to us. One of them was our mindset collectively. And the mindset at Flagship, which was embodied also in the mindset at Moderna, is this embracing of leaping, sometimes without regard to how safe it is where you're going to land. Because if you overthink how safe it is where you're going to land and how it is that there's land to kind of receive you, then you don't even leap, because you get stuck just like on a high diving board. I don't know if you've had that experience, but you kind of look down and then you really decide whether you should walk down the stairs. This is how it feels when it comes to leaping. And in reality, that same ability and let's say habit of leaping actually helped us in thinking about leaping towards really an unthinkable task of designing, making, testing, developing, scaling up, and introducing to the world a vaccine, not only for the first time for our company, but for the first time in the world. Nobody had ever used this technology for a vaccine before. Before the pandemic, we were the only company that ever used this technology in any vaccine. And we had 9 vaccine programs in clinical testing in humans before this pandemic started. And there was nobody with any technology in this space at the time that was already even at that level. So I would say that the readiness we had of not hesitating when the call was there to actually leap and say, you know what, we're going to figure this out. If you ask yourself, how do you know it's going to work? You don't even try. If you ask yourself, what do I have to believe it may work? And what are all the things I'm going to have to bring along with me to make sure that I can iterate and adapt and change? That thinking is how we develop our platforms, pandemic or not. And it definitely helped us under these circumstances. I've often been asked recently, kind of what do I attribute kind of at the end of the day, having some modicum of results at the end. And I think part of it is this notion of options. So we carry with us, just like you might, pack a lot of things if you're going to go for a long voyage, not knowing what you're going to face. We pack a lot of options along when we go on our explorations. And this was no different. We had a backup to backup to backup brought along just in case we were met with surprises. And we were met with lots of surprises, but not so many that our options ran out first.
That's really interesting. But you're dealing with human health. And so if you're leaping at Apple or Google, the consequences of not being structured and disciplined also are not as severe, but when you're dealing with biotechnology and human health, how do you integrate the structure that you need for scientific development?
You know, being in a heavily regulated field and having both the medical community and the regulators very much in a collaborative spirit over the last 18 months has gone a long way in making possible what we were able to do. We would not have been able to leap on our own. But because early on, really quite miraculously, everybody decided that this could be so serious that we needed to do it together, even if it's slower to do it together and it's a bit more conversations and maybe even puts constraints on us. We chose to work with Operation Warp Speed, with the NIH even before, with BARDA, with a wide range of clinical sites. The result of that was that not only did we have our own, intrinsic paranoia about what might go wrong, but we had all of theirs. And we wanted theirs because we wanted to make sure that, we did not want to make mistakes that could be foreseen. We knew we'd make mistakes, but they had to be new ones. And the more people you have coming along, making sure that they bring out, look, study this. As an example, I'll give you, when we first went down this path, there was concern in the vaccine community that the antibodies that would be generated against the spike protein would in fact enhance the disease, not fight the disease. You can't imagine how much effort we put in to something that turned out to be completely absent, but we had to, because in the small possibility that that happened, it would have been too late because the whole vaccine program would have been shut down. So these are the kind of things that a mindset that we could, look, we had to do the best we could possibly do with all our partners. We couldn't do any better, but we also couldn't do any worse. And that was the mindset we used.
And so, how would you describe the importance of the collaboration between the public and private sectors? You've worked very closely, as you just mentioned, with the National Institutes for Health and, of course, the National Institute of Allergy and Infectious Diseases, which is part of NIH. How important is that collaboration in terms of biotechnology innovation going forward?
Well, it was singularly enabling in allowing us to do what we've been the beneficiaries of collectively, and that is to secure the resources, to secure the opening of doors needed to act quickly, resolutely, and with a focus on getting to show not only efficacy but safety in the best possible way with the best experts advising us. And we did that. We did not take any shortcuts, and that was really important to us and to everybody else. Now, going forward, how might these learnings apply to how biotechnology, which is always working on life-saving activities, or whether it be even in sustainability and nutrition and food security. The question is, why should we stop doing that? Does it really take a pandemic for us to work together? Does it have to? And that's a question of human nature. That's a question of when do you compete, when do you cooperate? And of course, the conditions sometimes dictate people's interests. But I also think that cooperation had gotten a bad name generally before this. And I really hope that for the foreseeable decades, it actually maintains a good name. I hope that in our memory will be the fresh example of how much more powerful it is if people actually agree to align, to communicate, to have a level of transparency. And I think that, I think that this pandemic, while it has been devastating to human life and to causing long-term sickness, we have many other sicknesses that are as devastating. They just are slower pandemics. This was not the first pandemic we're facing and the only pandemic. This is the fast pandemic. There are also slow pandemics, whether it's in neurodegenerative disease or cancer or obesity, cardiovascular, that are taking tens of thousands of lives in front of us, hundreds of thousands. So the question is, why shouldn't we take these learnings and apply them to those areas? Why are these lives any less important, urgently important? And I hope and I think that governments and society has to really ask that question. For example, the thing we've been thinking about is, should we have a human right to demand of our governments health security? Should governments prioritize securing our health, not providing us treatments when in fact they fail. Securing health is not the same thing as being healthy, because being healthy, watching what you eat, etc., that's even a precondition. But securing health means to delay and deter the disease and its impact for as long as possible. And I think there's a lot we can do with modern science, technology applied to that end of things, that the pandemic should give us a template to attempt to pursue over and beyond infectious diseases like this pandemic.
So, in turning to your mRNA platform, which you've described as a potential for revolution in the making, so what do you see as some of these potential revolutionary impacts that could come from the work that you've done on the COVID-19 vaccine? And even prior to that, obviously, the vaccine came out of your original curiosity and fascination with mRNA technology.
Well, the audience might be surprised to learn that long before there was information technology as a field, biology is the ultimate information technology field, because the fact that we are repetitively making cells and doing things as humans, as animals, as every life form, is an incredible feat of information transmittal. The underlying genetic code we know is in DNA. The actual actors that do things generally are proteins. And in between is this quite curious molecule that essentially is a copy of all the parts of DNA you need to execute life, and just enough of it, not too much, not too little. And this constant transmittal of information from your storehouse to proteins, just like a computer, goes from kind of stored hardware, now in the cloud, all the way to an actual program running. That same methodology is very much the basis of how life works. It's just that the IT field advanced a lot faster than biology could figure out what's going on, but now we're catching up. And the reason that's an important observation is that the mRNA is an information molecule. It is just like any other code. It can be recombined, it could be rapidly altered, it could be inserted to cause a program to do something different. So all the things we're used to when it comes to software, that's why we call this the software of life, is available. It's not just a metaphor, it literally operates like software. So the fact that we could take the sequence of this virus, focusing on the spike protein that we knew historically would be an element of exposure for the virus, and then very rapidly design a sequence and make it within days, 1 or 2 days is what it took to actually make the first molecules. That would be unthinkable if you were dealing with traditional pharmaceutical molecules, chemicals, or the ultimate protein, because the protein itself ends up not being as programmable and as manipulable, but the RNA is. So that insight that led to the creation of the mRNA platform, with Moderna pioneering it, ultimately will lead to many, many drugs, because out of the one will come the ability to make many others. As we know what to direct a therapeutic effect to, we can design a different mRNA and test it and eventually develop it as a drug. Likewise with vaccines, where again, once you know one vaccine, you can reprogram to another and another and another. And that is what we mean by kind of a revolution in the making, is that it's not about one instance, it's a whole paradigm that is going to sit alongside small molecules and proteins, which are the only other two forms of drugs and vaccines that are out there. And the excitement of that is, it's almost hard to imagine what will become possible if your cycle times become days and weeks and not years and years just to do the science.
So your development of the vaccine has been compared to the Manhattan Project, which unlocked the secrets of physics and changed the course of history. Do you think we're at the same inflection point?
I don't know if people during the Manhattan Project quite felt like it was the Manhattan Project, in the sense that they probably had something to get done, and they focused a lot more on achieving their objectives than the ramifications of it. And I would say that likewise, we have not necessarily envisioned the ramifications. I could tell you one thing, though. We have talked a lot about the Manhattan Project in the context of the past year as it relates to what getting a government kind of led but coordinated effort can do. It can do just about anything. And this notion that suddenly if the government's involved, nothing is going to work is demonstrably not the case once in a while. And it was not the case in this case. So the question then becomes, do we need a Manhattan Project, everything we need to get something big done? And I'd like to believe not. And that's what I was referring to earlier, is that I'd love to believe that some of these things can be used in peacetime. By the way, a lot of what ensued in physics and the Department of Energy came out of the after effects of what was done in World War II. Likewise, I do hope and envision that a level of investment will be made in further deriving the fruits of this bio and technology combined for the betterment of mankind. So in that regard, if it's a time-based event that triggers a new era, then by all means, I think it can be viewed in that way, a phase change, a phase transition.
That's interesting. That's really interesting. And then just getting to the variants, because there's been a lot of discussion, particularly over the past couple of days, about the variants and the vaccines and whether another booster is going to be needed. I know you're working on dealing with the variants. How do you see this playing out in terms of particularly not only the Delta variant, but what may come next and the efficacy of the vaccines?
Well, I think anybody that makes definitive statements about this today is guessing, because you have to realize that the virus has a very strong capability to mutate and to alter itself depending on what kind of immune response it's encountering. And our immune system also has the ability to alter its behavior in order to fight more and more variants. The problem is that does not happen in isolation in a test tube. When it happens in our bodies, there's a lot of people who are adversely affected by it. So in that battle between our evolving immune system and a virus that's itself evolving, the only thing we can do as humans is to come in and basically tip the scales in favor of our immune system. And to do that, we need vaccines of the original type that we have, and we may well need variant sequences in our vaccines. Now, to prove that, to know that that's what's needed, is going to take continued scientific work, testing in humans. But one thing we know for sure is that we can't wait till the problem has arisen again and we now have a new pandemic. These waves of a pandemic makes us, I think that somehow it's the same pandemic, so how bad could it be? If you just called each wave a pandemic, which we can, then you realize it's yet another pandemic and yet another pandemic, even if it's deriving from the older ones. So I don't think we're anywhere out of the woods at this point. I think vaccination as thoroughly as possible is the only way we're going to be able to fight this. If this virus was a little more tame, we might have gotten away with some degree of isolation and some amount of vaccines. But it's clear that these variants are coming back with dramatically increased transmissibility, which means that even if people who have been vaccinated in some small subset of cases get reinfected, their ability to transmit is just the same as people who are transmitting who have never been infected. And so we've got to contain the number of places the virus can find an opportunity. And the way to do that is going to be to be very, very diligent in pursuing variants with boosters, with increased vaccination to unvaccinated people. We're going to be in this fight for quite a while.
So given the challenges ahead, what would you say are the most important leadership lessons you've learned from this experience to date?
Well, I think first of all, the ability or the need to decide to go after a big challenge when the need is there, but where the pathway may not be as clear. I think that was an important part of how we, and maybe in our case, because we're by nature insurgents, we're not incumbents, that might have been an easier decision for us. But certainly that would have been a leadership challenge if we tried to figure out all the things that had to be right in order to go down this path. I think that the ability to create a culture, a work environment that kind of rewards, recognizes, and encourages folks to do the kind of thing that it took the Moderna scientists and engineers and the whole population, what it took, the sacrifice they made, that can't be built overnight. You need to have that underlying foundational culture to be able to respond. You can't just overnight hire consultants and say, make people into heroes. Unfortunately, it doesn't work very easily. I think a degree of like I said earlier, collaboration is a massive thing. So how do you lead when you're typically competing now in a collaborative, cooperative way? I'd say another thing is being ready for a constant barrage of unexpected challenges, whether it be from people who don't believe what's being proposed, or people who are worried that things are going to be you're not going to be able to do what you're setting out to do. These are all things that, the notion that can be off-putting is a luxury that we could not afford. So an important leadership attribute, I'd say, would have to be anticipating what it's going to feel like to be in these fights, and to constantly keep in mind who we're doing this for, what success looks like, having in mind what the end result is that we want, was a really, I'd say, clarifying thought when everything was bleak, and where there were many more ways we could describe how this won't work than there were ways it would work all along. And the question is, how do you, as leaders, despite that, find a way to have people think clearly about doing whatever we can to allow for success to find us? Right? So you can't engineer success, but if success was even there, you have to allow it to emerge. And that kind of thinking, emergent thinking, was also something that this was very, very much an important way to think about life in the last year.
Can leaders teach their teams to leap, or do you have to hire leapers to begin with?
I think that experience in leaping matters, and I think people are constantly within our environment surprised at just how much leaping ability they had when they had convinced themselves that they don't. And so while I cannot say that you could take every single person and make them into equivalent leapers, you can certainly get, my observation is that people can generally leap a lot more than they thought.
So culture and purpose is really important.
Yeah.
And so to my final question, Noubar, and thank you for joining us, is who are the most important leadership role models in your life that helps set the course, the compass for your values?
Well, it's not a question that's easy for me to answer, because I've observed a lot of people, and no one or two people in particular. I've been experimenting and iterating and listening to lots of folks, as opposed to kind of apprenticing, whether they know it or not, with one or two folks. So I've learned a lot when I was in graduate school from the person who was my thesis advisor, who ran a very large group, as to how he went about doing things. Early in my life, I learned a lot from a gentleman named Jack Smith, who was one of the earliest employees in Digital Equipment Corporation and eventually became its president. That was a company that went from 0 to 200,000 people down towards its end of life to a much smaller number. So he had seen the rise and eventual fall of quite a technology platform. And I learned a lot from him about how they thought about it. This was now 35 years ago, so I owe a lot of learnings to him. But along the way, people like Bill Pounds, who was the head of the Rockefeller Corporation, but also the dean of the Sloan School at MIT, a terrific mentor early in my life. And then throughout, so I can name many people from whom I've had observationally or directly conversations that have given me points of view and ways to think about it. And I must say, I think a lot about these things and I experiment with them and hope that someday some of the things I've learned can be helpful to others as well.
Well, you have been extremely helpful to the country, to the world, and it is really our privilege at the Committee for Economic Development to be honoring you this year. Thank you for all you are doing and all you have done and all you will continue to do, and for sharing your insights with us today. It's been a real privilege.
Thank you so much for having me.